So I'm going to welcome Jess Drinkwater and Claire and Martin, if they're all here, to come and lead us through. We put out a request for, does anybody actually want to come and speak at this conference? And these guys said they did. So they got in. And they're going to come and talk to us about working with people, communities to improve services. So thank you so much.
Hi everyone. Thanks for having us today. We've been working on some stuff and we wanted to try it out. And we wanted to make it as interactive as possible, and I think we've probably been massively overambitious. So we've got technology to manage and loads of different things that is not going to work. So fingers crossed. So I'm Jess Drinkwater. I'm a GP in Bradford, but I trained in Manchester. And I work in a deep end practice in Bradford. And I'm also a researcher at the University of Manchester. I've got Claire with me, who's a researcher at the University of Manchester, and Martin, who's a public contributor. And today we're going to be talking about working with local people and communities. And by that we mean outside of the consultation. So we mean various different things. So it might be within the practice, working with a patient participation group. It might mean going out and working with a charity or local organisation. And before we tell you much more about what we've been doing, we'd like to know a little bit about you. So we thought the easiest way to do this was to get you all to stand up. Okay, so what we'd like to do is stay standing. If you believe it's the right thing to do is to work with people in local communities on service improvement. So stay standing if you think it's the right thing to do. Okay, so that's pretty much everyone, and also possibly a bit scary to sit down from that one. So the second one is whether you think GPs, specifically GPs, should work with local people and communities on service improvement. So stay standing if you think it's the GP's role. Okay, so there's a couple of people who are sitting down. That's great. So stay standing if you think it is your role, your individual role. You would like to work with people and communities on service improvement. So there's a few more sitting gently, okay? And then stay standing if you have worked with local people and communities on service improvement. Okay, cool. So there are a few people who have had some experience of working with people and communities. And basically that kind of fits with our research as well. We found that actually, GPs would like to do this, but it's really hard to do it. So this is just a quote about to bring you back to the policy, about what the policy says about whether we should be doing it. So this is the Fuller Stocktake review. And learning from COVID said that, we should be developing meaningful, sustained relationships with people and communities and using their resources as assets to understand their lives and work with them, but that it shouldn't just be considered a bolt-on to the day job. It's essential that people's roles should be reflected and protected time and job plans for both current and upcoming roles. And actually this working with people and communities was part of the previous service specification for addressing health inequalities for PCNs. So it has been put in our roles, but we don't think that GPs have been given any resources to do this kind of work. So we set about doing a research project.
Okay, so we decided that we would do some research to explore what it's actually like for GPs to work with people and community groups. So over the course of 1 year, we recruited and worked with 8 deep end GPs who were on a post-CCT fellowship scheme. As part of that scheme, they had a paid role, so the equivalent of 1 day a week to do CPD work and to conduct a service improvement project. And then as part of our research project, we were encouraging those GPs to work with people and community groups on their service improvement project. We then met with those GPs on 6 occasions and we interviewed them 3 times, so roughly at the beginning, middle and end of their service improvement projects. And we also encouraged them to record audio diaries reflecting on their experience of working with people and community groups. And as part of that project, we work closely with our co-research group, which Martin is here to represent today, to understand the research data that was coming from the project. And then together we have developed a fictional film, which is based on the experience of those GPs. And we're really excited to share with you today some clips from that film, which is exploring what the GPs, how their experience of being involved in those projects and working with people and community groups. And this is really an opportunity for you to think about how you feel about doing this type of work.
So basically when we invited ourselves here, we said, can we have quite a lot of time to show you long films, but they gave us 20 minutes, so we've only got a short bit of time. We've got films that cover the kind of whole year of Dr. Walker, who's a fictional character based on the research, and a whole year of her work of trying to work with people and communities on service improvement. So the first kind of 2 to 4 months was really, she spent the time trying to work out what we meant by working with people and communities, because she didn't have any role models, it wasn't part of the training, it wasn't something that she was seeing other GPs doing, and also that she was new to practice and wanted to be seen as a good GP. And if you can't find other GPs doing this work, then you don't know that it's actually part of your role and it's a legitimate part of your role. She then kind of had to think about how to work with other people and talk to other GPs, but they didn't really know, and then went out to sort of community groups, but went to the managers and talked to them. And finally, she kind of got an opportunity to go to a community coffee morning, and she was interested in improving disabled access in the waiting room. So this was a community coffee morning with families with children with physical disabilities. But it was really, really hard because she'd had to do things like even learning to write really nice long emails to keep people on side, which was completely different to responding to tasks when you just do one-word replies like no, sigh, go away. So the emails just took forever. So what we'd like to do is we're going to show you a very short clip of her thinking about. She's the night before the coffee morning, and it's how she's feeling about going to the coffee morning tomorrow. And we'd like you to watch the film and think about how it makes you feel and what you think about what she's doing.
I really have to control these nerves before tomorrow. I cannot let them see me nervous. It was one thing when I was just going in and meeting with the group leader, but tomorrow I will be talking to the parents and kids. This is so different from anything that I've ever done, and from my day-to-day. Definitely wasn't covered in training. Give me people to talk to in a consultation, and I know where I am. But talking to a group, talking to people outside of the practice, well, that feels harder. My biggest fear is, what if they just think I shouldn't be there at all? That I'm wasting their time, and that I'm wasting mine, and that I should be at the surgery seeing patients. I always feel like that when I'm outside of the practice. And I get it with how hard it is to get an appointment, which does then make me think, am I the best person to be doing this work? And this is going to sound daft with all these other things, but it's really bothering me. What do I wear? Should I turn up formal so that they know I'm a GP, or should I dress down so that it makes sense me going into the community and joining in? It makes me think of that time when I did the park run and I was all sweaty and a patient said hello. It just caught me off guard. How am I meant to be a professional in a setting like this? No one ever talks about it, and who would I ask without looking ridiculous?
So the next film is, so what we'd really like to do is we'd have a really big chat about what's going on in the video, but because we're on time schedule, we're going to show you what happens the next day after she's come back from the coffee morning.
Well, that went better than I expected. I feel happy that I finally went to one of these groups and I made it happen. They were definitely surprised that a GP was attending, pleasantly surprised, I think, which was great, but also slightly chastening that they could be shocked to see a doctor in their community setting. There were more people there than I expected, including practice patients. But I enjoyed talking to people without time restrictions and listening to what they had to say. They were all very welcoming and didn't complain about the practice, though it was a lot of work trying to learn and remember names and to talk to people in a way that wasn't like a GP talking to a patient, to be a bit more, well, level, I suppose, which does make me realise I do talk differently to patients. Like, if I'd have met any of those people in the consultation room, we would have had very different conversations. I don't know if that's just the nature of the job or something I need to think a bit more about.
Yeah, so that's really nice that you say that, because we found one of the things in practice is about power and about the GP power that we have within consultations, and then how we use that for advocacy, but also how it can be a barrier to people talking to us. And sort of as a group of GPs as well, we can get quite internal in our head and worrying about things like how patients will perceive us, and we don't usually ask them feedback. But let's go through. I'm just going to go through again, and we'll come. It's at the end. So the benefits that we found from the research are that actually the GPs all did try and do service improvement things. So they worked with GPs on, one worked with a men's group about access to general practice. Another one did stuff about raising awareness of Healthy Start vouchers. But also what we found across all of the GPs was that they had a greater understanding of the lives of local people, which they used in their clinical work. And they had a greater understanding of local community groups and services, which they could then refer people to. Some of them did say they made changes in consultations. They had a wider network of support because they knew about local charities and third sector organisations. That helped them really reconnect with why they originally went into being a GP, because they were doing some of the stuff that they thought GPs would get to do. And they said they would be more likely to stay in their practice now because they had a strong community connection with their place where they didn't tend to live because it was a deep end area. So a couple of quick last, and you can send the slides out. There's a couple of quick research things. There's 2 deep end groups have produced Equalise and Fair Steps, which is about doing service improvement, and both say, actually, if you're going to do good service improvement to address inequalities, you need to work with local people and communities. There's about to be an NHS England Future Learn course, which you can dip in and out of, about working with people and communities. And then the last slide is a thank you. And if you have any questions, I'm going to be hanging around. And Claire's hanging around and Martin's hanging around. And I'm going to try and put like a survey on Mentimeter, but it probably won't work. But if you want to take a photo of it and give us some feedback, that would be really helpful.